What could go wrong? The dangers of blood transfusion errors. A blood transfusion is a procedure to replace blood lost due to injury or illness with donated blood. During a transfusion, the donated blood is delivered to the patient through their vein and then pumped to the heart and throughout the body. While this life-saving procedure has been around for over 100 years, mistakes can happen. And in this video, we will explore some of the errors that can occur during a blood transfusion and their potential consequences. Transfusing the wrong blood type. One of the most critical errors that can happen during a blood transfusion is when the patient is given the wrong blood type. Blood types are determined by the presence or absence of certain antigens on the surface of red blood cells. If a person with type A blood, which has A antigens, is given type B blood, which has B antigens, the recipient's immune system will recognize the foreign blood cells as a threat and attack them. This can cause a severe allergic reaction known as a hemolytic transfusion reaction, which can lead to kidney failure, low blood pressure, and even death. To prevent this error, blood products are carefully typed and cross-matched with the patient's blood before transfusion. Incompatibility between the donor and recipient. Even if the blood types are compatible, there still is a chance that the recipient's immune system may reject the donated blood. This can occur if the donor and recipient have different Rh factors, which are proteins found on the surface of red blood cells. If an Rh-negative person receives Rh-positive blood, they may develop antibodies against the Rh factor, which can cause problems during future pregnancies. If the baby inherits the Rh-positive blood type from the father, to minimize the risk of incompatibility, it is important to use blood products from donors who have the same Rh factor as the recipient. Transfusing the wrong blood products. Another serious error that can happen during a blood transfusion is when the wrong blood products are given to the patient. For example, if a patient needs platelets to prevent bleeding, but they are accidentally given plasma, it can be life-threatening. Platelets and plasma are two different components of blood that perform different functions. Plasma is the liquid part of blood and helps to transport nutrients and remove waste products, while platelets are responsible for blood clotting. Giving the wrong blood product can have serious consequences for the patient. Therefore, it is important for healthcare providers to double-check the blood products before administering them to the patient. Failure to monitor the transfusion. It is also important for healthcare providers to closely monitor patients during a transfusion for any signs of a reaction or complications. Failure to do so can result in a delayed reaction, which can be more severe than if it had been caught early. Signs of a reaction can include fever, chills, wheezing, and hives. If a reaction is suspected, the transfusion should be stopped immediately and the patient should be monitored closely. While blood transfusions are generally safe, it is important to be aware of the potential errors that can occur during the procedure. By understanding the risks and taking the necessary precautions, healthcare providers can help ensure that blood transfusions are safe and effective for patients. This video was created for educational purposes only and is not intended to substitute a professional diagnosis. If you suspect you have a medical condition, please contact your healthcare provider.